Hey everyone, I'm Dr. Brent Thierry of Total Spine Health and Injury Center, your Maple Grove chiropractor. Our medical system is broken. The costs of care are skyrocketing. The providers, the doctors, the nurses, the staff are all overworked. Over 130 million Americans are on prescription drugs, with the average of those people taking 4 separate prescriptions. And that's not even including over-the-counter medications. And what's our reward for these efforts? It's a consistent rank towards the bottom when comparing the health of Americans to other wealthy countries. But none of the above things are the root cause of the problem. They are simply the symptoms. The problem with our system lies in the underlying philosophy and how we fundamentally approach our health. We're focused on crisis rather than wellness. It's built for putting out fires, not for keeping them from starting in the first place. We have a sick care system rather than a health care system. We're conditioned to ignore our health until it becomes a problem. But we can't only pay attention to our health when it screams loud enough for us to hear. So let's highlight some of the main differences between a true healthcare system and a sick care system. So first off, true healthcare is proactive rather than reactive. So being proactive means that we take the necessary steps for health before we have problems, before we have symptoms. It means that we are consistently making choices that we believe will have a positive effect on our health now and in the future. We don't wait for a problem to start making a change. Now, I want to be clear because I know that for some of us watching right now, we're in reactive mode. We're dealing with a sickness or a disease or an ailment, and we're just trying to heal and get better. And I get that. So my challenge then would be to take the necessary modifications that are needed for healing and symptom relief and then transform those into lifestyle modifications that can be applied preventatively. Now, I know that finding the motivation for being proactive in our health isn't always the easiest. Getting out of pain is often a much greater motivator for taking action as opposed to making a healthy change that will improve our quality of life down the road. But we need to put things in perspective. We need to think long term, and that means making a shift in our approach to health today so that we can have a healthier tomorrow. Now, number two, true healthcare is function focused instead of symptom based. So symptoms are often a poor indicator for health. Many of the most prevalent diseases commonly operate silently. Conditions like cancer, heart disease, arthritis, they can often operate asymptomatically until they've reached progressive stages of disease. In fact, the very definition of health often makes this very distinction, stating that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. So why then do we continue to base our health primarily on how we feel rather than how our body is actually performing? It's possible to feel well and have compromised function, but it's not possible to have suboptimal function and still feel our best. This relationship, it means that function should be at the center of our health approach. We should be focused on how the body is actually working. And finally, number three, a true healthcare system values optimal over normal. Now, this one might sound confusing, but let me clarify. You're probably thinking, isn't normal good? Don't I want to be normal? If my health is normal, doesn't that mean that there's nothing to worry about? Now, the reality is that normal health can be a far cry from being functionally optimal. Normal results don't mean that they are optimal for your general health, your physical, your mental, and your social health, or your longevity. We can often be classified as being in a normal state of health since our condition hasn't yet progressed to a state of disease or even symptoms, but it doesn't mean that it's not dysfunctional. In fact, focusing on normal health can actually be dangerous. Being comfortable with average can give us a false sense of security, which really prevents us from taking the necessary steps now to move towards optimal health. It can make us feel like we're doing everything right, when at the same time, we're missing out on all the amazing benefits we could be receiving if we continue taking steps toward truly optimizing our health. Now, I know our healthcare system isn't going to change really anytime soon, but what can change is our personal approach and our personal philosophy when it comes to our health. We know that the if it's not broke, don't fix it mentality doesn't work. If we wait to address our health until we're already sick, it's the same as waiting for the check engine light to turn on in our car before we change the oil. So my question is, what types of changes can you start making today that will make a benefit in your health? On some level, we all know the choices we need to be making for our health. We all know we need to be eating a healthy diet, exercising, drinking enough water, getting enough sleep. I'll give you this. The real secret to health is that there is no secret. A healthy lifestyle isn't rocket science. It's simply the cumulative effect of the small, seemingly insignificant decisions that we make every day that add up to a tangible result. And our goal is to make sure that when we add those decisions up, they are moving us in a healthy direction. So let's choose to be proactive. Let's choose to focus on function. And let's choose to go after optimal rather than settling for normal. And when we do that, that's when our approach to health can evolve. Thanks for spending time with me today. I hope this message brought you value, and I look forward to seeing you in our next video.